So welcome everyone. This is the Marin County videotaping of how to use the COMPASSEZ tool. This is the COMPASSEZ, and this is going to be the object of our attention for the next little bit. And we are here with today a group of folks who have kind of stepped up to the plate to help everybody out. It's a beautiful team of people. This is the Odyssey team. And Chris is going to tell us just a little bit about the Odyssey team before we start talking about the Compass. So take it away.
So the Odyssey program is in the adult system of care. It's a full service partnership offering intensive case management to individuals with a diagnosis of a mental illness and who also happen to be homeless. So we are an intensive case management team that serves that population here in Marin County.
Thank you very much. What I think we will do, if you guys wouldn't mind, I would have you go around and introduce yourselves for the folks who are watching on the video, and then I'll come back and go over the instruction set so you guys can introduce, relax, and then we'll be back on with you guys as a team. So you want to start us out, Chris? Go ahead and say your official.
Chris Kuhn, supervisor of the Odyssey program.
Liz Ramos, senior peer case manager.
Aldemar Martinez, case manager with the Odyssey program.
Moshi Abrams, case manager with the Odyssey program.
Louise Sweeney, nurse practitioner with Odyssey.
Linda Beth Unclis, peer case aide.
And Paul Stelly, senior peer case manager for the Odyssey team.
Thank you. And we have Kathy Kipp joining us today, who is the project guru for the Marin County Integration Project. So my name is Dr. Chris Cline, and I am contracted to Marin County to help with integrated services development. And one of the things that is happening in the system is that all of the programs are joining in kind of a mass collaboration for quality improvement to think about how to be a better match for the people who are needing us. And one of the areas of interest in this whole integration process is to be thinking about what it is that people who have complex needs actually need from us, and how to organize everything that we do at the program level, the system level, the clinical practice level, to be a better match for what people actually need. And in service of that mission, my partner and I, my partner is Kenneth Minkoff, we have created a number of handy self-assessment tools for folks to use to look at various aspects of the service system. And the COMPASSEZ is the tool we're going to be talking about today. And this is the self-assessment tool that's designed to help programs look at how programs are designed to move in the direction of a term that's called co-occurring capability, or complexity capability if you really want to stretch the envelope a little bit. So the COMPASSEZ, it's a simple little tool in that all it is a set of questions, and it's intended to promote a group conversation by the folks who actually operate and have influence over the programs. And the conversation, I think, is probably most important to say this right up front, is that this tool, the single most important outcome of this tool is the conversation that a team of people would have with one another. And so if you hold that as the objective of what the framework for this tool is, it's about creating a conversation around co-occurring capability by a team of people who have in front of them kind of a shared mission to move their services in the direction to be a better fit for the people who are needing them. If you focus on the conversation, it becomes really easy to understand how to use a structured tool like this. Now, second most important thing, if you're in the I might be doing the Compass framework someday, I'll say this, and I'll probably say it several times. It's really very helpful. This may seem a little bit silly, but it's really very helpful to actually read the instructions. I know we're very good at putting, bicycles together at Christmas without ever reading the actual instructions. But it's very helpful in two ways. The instructions actually describe the process, but also embedded in the instructions are definitions of things definitions of co-occurring capability, definitions of complexity capability. There's a framework about what this actually is and what it's trying to promote. And so just simply by reading the instructions, not only do you learn how to use the COMPASSEZ effectively, you get a big picture of what's going on. So I highly recommend everybody watching the video, your first step when you finally sit down is to actually read those directions. So I'm going to walk through the instructions a bit, not to read them to everyone, but just to highlight some things that are important. Okay, and I have to wear my reading glasses to do this. So now, the compass it's a pen and paper tool. It is a tool that you go question by question, and the team is in the process. The team creates a conversation, and then they score the organization on a scale of 1 to 5 in terms of how that team actually feels collectively where the organization is. So it's a scored tool. However, the score itself is simply a benchmark that you might want to use in the future to kind of judge your progress against. It's not a score tool in the sense that 1 means bad and 5 means good. There is no good or bad. It's simply, if we were going to have a starting place, where are we? And we go forward. So you have to do a little bit of work to detach yourself from the framework of what numbers and scores mean, so that it doesn't get in the way of you actually feeling like you can comfortably talk. Okay, so that's really important to know. The tool's divided into all things about programs. And so on the little Roman numeral III, that page, they're the compass domains. They're broken down into things like program philosophy and access, screening and identification, all the way down to things like program collaborations and partnerships. So the tool's divided into these 15 sections. And underneath each of those sections is just a simple set of questions that relate to that issue. The COMPASSEZ itself is intended to be used by all kinds of treatment and service delivery programs. So for example, it's the same tool that you would use. It's the one COMPASSEZ that you would use if you're like yourselves, mental health, homeless case management program. You would use the same tool if you're a residential addiction treatment program. You would use the same tool if you are an adolescent outpatient program. It's one tool for everybody. And the reason it can be like that is that the stuff that's in here is so fundamental about being a good match for people with complex issues that it sort of can transcend a lot of the usual boundaries in the system. Now, there may be things in here that you find when you're doing the tool that seem like the perfect, most logical fit. You're already beautifully working on them. You're very, very proud of the progress that you're making on them, and it's still intending to be something that you're carrying on with. And that's fabulous, and we want everybody to actually find as many of those things as you possibly can, because those are your strengths. And just like we want to be with everyone we're working with, we want to be strength-based. So finding those great moments where you say, that's a perfect fit, that's beautiful about what we want to do, that's lovely. There may be things in here that you may not have even considered. We didn't know that was even something to think about. We just never thought about it. And that's great too, because those are opportunities to have new ideas. And there may be some things in here for some folks that when you read them, you say, I don't think so. That's just not what we do, and I'm not sure that it is what we want to do. And those are actually good to run across as well, because what those questions are intended to do is to deepen the thinking. Okay, and so regardless of whether it's something you feel very facile with already, or it's something that you're not even sure it's something to be considered, the conversation that it promotes is really worthwhile. Out of that conversation, out of going through all of this together, you're likely to find the handful of things as a program where you go, that actually makes sense to us. Okay, that's where we want to go with this. It builds off of what we're already doing. It gave us some great new ideas about things that we think are smart that we want to hook up together. And it challenged us to kind of step outside of our box for a little bit. That handful of things, that's what you want to convert from a conversation into the thing that we lovingly call an action plan. Okay, what are we going to move on here? Okay, and how would we do that as a team? So first object of doing the compass is to create that conversation. And then the second object is to say, out of what we just talked about, what do we intend to do? Where are we going to go with this? Okay, and if you meet those two objectives in compass doing, you've been highly successful. And you could have scored all ones, or you could have scored all fives. It doesn't matter. Okay, so when we work with folks, and we do this all over the country. The Compass EZ has been used by probably thousands of programs now. And there's a couple of things, just to give you guys a little bit of like the nitty gritty, pieces of advice as you go through. When you start using the compass as a team, the initial questions, what they have a tendency to do is they sort of open the whole topic up. So being a good fit for people who have complex issues. What is that anyway? Okay, so we're talking about mental health and substance use issues, trauma issues, physical issues, housing issues, justice issues, all sorts of things that people, social child welfare issues. I'm talking about really complex people. And the tool immediately challenges frameworks like being built to welcome people with complexity into care. Okay, and because these are fairly large, they're extremely large concepts. When you begin using the compass, usually what teams do is they spend a little bit of time just sort of put stuff out into the middle of the ether. There's stuff we've been thinking about, talking about, and we got to get going in the conversation. And so having a little bit of open space in the beginning of that conversation is actually really helpful. Okay. However, it's long. It's shorter than it used to be, but it's still long. So after a while, you need a strategy to kind of get a little bit of rhythm to get through it. And so here's the strategy for rhythm. What we suggest that you do is that you actually take turns reading the question of the moment. Okay, so like Paul, you would if we started at this end of the table, you say, okay, I'll read the first one for the group, and then the next one, and then the next one. And it's important to have a reader, because what the reader's job is going to be is to make sure that that question actually gets answered. Okay, so people have a tendency to use these questions to answer all the other questions, particularly the challenging ones. And in the end, you do actually have to answer the question that's on the page. And the reader can bring you back to focus and say, well, guys, I think we've been, all the way around the world and back. So let's read the question again and actually pick our number. What do we think? Okay, so you're kind of team facilitating, everybody taking turns. And it's kind of fun that way, because you get your little piece of, I can move my group here. So it's actually kind of fun. Now, a little bit in the rhythm of doing things, the scoring it's like whole numbers, 1, 2, 3, 4, 5. Okay, well, that's really hard for people to actually agree sometimes on things that they have really different opinions on. And that's good, because difference of opinion is where you actually find opportunities. Okay, so that's really good. For the most part, a team of people can say, yeah, I think we can kind of call ourselves a that. That's 3. That's cool. But there will be some questions where you say, no, I'm going to fall on my sword for this one. I'm going to stay a 1, and you think we're a 5, and we just fundamentally disagree. And that's okay. You can annotate that. Okay, what you don't want to do is say, well, then that makes us average, a 3. Okay, because no, it actually doesn't. It really doesn't. It means that there's something profoundly different in your experience. You want to know what that is and not just say, well, then we're fruit juice. We're apples and oranges. No, we're fruit juice. No, we're apples and oranges. Okay. So you may have 1 or 2 or 3 questions like that. Okay. If you find yourself doing that a whole lot, think about what that represents. Okay. We're a group that fundamentally doesn't agree. Okay, and that may be something that you want to think about organizationally. Okay, but if you hit the random question where that happens, no big deal. Just realize what it means. Think about your differences and document. That's fine. If you are like splitting hairs and you say, well, I think we're at 2.75. It's like, I'll come around and I'll help you with that later. It may involve therapy, but we'll take care of that. Just do the best you can, pick a number. It doesn't matter all that much anyway, just move on with it, okay? It takes about, if you're a good, healthy organization, meaning that you can talk to each other already, which I know you guys are, it takes about 2.5 hours to do the whole thing. Because when you really get in a good conversation, you actually do want to talk to each other. And so it takes about 2.5 or 3 hours. Most organizations will opt to do this all in one big shot. They'll just say, let's do our compass right now, get all through it. Some organizations will say, there's no way we could have a conversation for 2 or 3 hours. That's okay, you can break it down by section and do it over a period of time. Okay. Just want to make sure that the conversation has a thread, okay, because it builds on itself. You just refresh the conversation each time you come together. Who would be doing this? And this is where we're going to get ready again because I'm going to migrate into your universe here. The team does this. Who is the team? It's really who's there. Okay, so what you want to, the sort of ideal of the ideal way of going about this is you want to look at your team, your program, like Odyssey program, and you say, who are we? Well, your case management, your people who support things, your people who provide peer attachments, your people who maybe there's folks who consult to you, whomever. There's a group of people who come together to do something called Odyssey, right? And that's who you want in this conversation. If you have people amongst you who are your service recipients and they are in the business of helping you develop your program, those are great folks to have at the table with you, and we would advise anybody out there in program land to think about how you get the broadest perspective. Okay, that's what you want. You want everybody's viewpoint at the table so you can see the whole thing. Okay. If you're a large program and you have hundreds of employees, then you have to think about how would we get representative voice. Okay. If you're a small program, it may just be you, right? You guys, right? If you're a complicated agency, like you're an agency with a big umbrella policy head, administrative framework, and then you operate many different things. Like we have a residential program, and we have an outpatient program, and we have a thus and such program. Each one of those programs would do their own compass, because each one of those conversations will lead to a fairly finely tuned improvement opportunity. Okay, so it kind of breaks down to the program level. Okay, so hopefully I haven't left anything out.